Hi everyone, hi. A really warm welcome to you all. My name is Hattie Taylor and I'm a district nurse in Dorset Healthcare and staff governor, and I'm here to introduce Andy Willis to you now, who is Chair of Dorset Healthcare and Council of Government.
Thank you, Hattie, and a very, very warm welcome to everybody. And obviously, thank you for giving your time. And we hope this session runs smoothly and without technological interruption or deviation. So I have as Hattie said, I have the great privilege of not only chairing Dorset Healthcare, but the Council of Governors. And so this, like all our annual members meeting, is very much a team effort between myself, our governors and the wider team. We've used an online facility again. This is the third time we've done this because of three really key criteria. One, we want to make it as accessible as possible, and the digital method is increasingly common for people to access this kind of members meeting. Secondly, COVID is proving a little bit of a tricky thing to predict. So what we didn't want to do was, one, put people at unnecessary risk by having a kind of in-person meeting, and also that variability. We had a spike at the wrong time. We didn't want to have to cancel the meeting. So COVID was the other factor. And then finally, increasingly important is us not transporting ourselves around large chunks of Dorset all the time and using diesel, petrol, and therefore the environment and the cost of living pushed us to this solution this year. That doesn't mean next year we won't do a blended session, but this year we just thought that was the best course of action. There are certain members of the Council of Governors that would have loved to meet you all in person, but this year it just wasn't quite possible. This year we're going to actually focus upon the change that Dorset Healthcare is going to go through and has gone through and will go through in the future. And we're going to look at that from the perspective of some of our services, but we'll talk more about that shortly. During the actual members meeting, you may find that your bandwidth on your broadband could interrupt delivery. We're recording it, so please feel free to actually listen to the event later if for any reason your broadband gets interrupted. But firstly, before we get into the nuts and bolts of the annual members meeting, the most important thing that we're here to celebrate is our patients and our patients' stories. And not only patients, but also our staff who support our patients and our volunteers who support not only the organisation and staff, but also through caring directly for patients themselves. So first of all, I'd like to hand over to the patient story. Thank you.
I became a care leaver last year on the 16th of October, the day I turned 18. And I've been supported by care leavers ever since.
Riley's one of the young people that was highlighted to me, like many of my young care leavers, who really, when they hit 18, a lot of the support drops off. And as we're now finding, they quite often sit in the middle of all of our services. So Riley is an example of someone with very complex needs.
I have suffered with mental health problems, and I also suffer with Tourette syndrome. I was contacted by the care leavers manager because my PA was off, and she was like, oh, I've got someone here you might like to meet, Abby. And I was like, cool, let's do it. So I did.
Riley is just an example of 60 minimum that I'm working with at the moment who really sit in the middle of all services, and I'm supporting them with drugs and alcohol, mental health, physical health, sexual health needs. Some of my care leads have got children, so it's about sorting them as new mums when they've got no family themselves, and also being a child in care maybe didn't have the best role models of how to be a mum themselves. So helping them navigate their midwifery appointments, taking the child to get their vaccinations, just helping them on day-to-day questions you'd ask your family members.
For Riley, accessing a health service from Abby is completely unique to what any other people would get, in that Abby would help him to be able to navigate and access services that on his own, without the support of a family or a social worker, he would probably really struggle to do.
Because everyone assumes when you turn 18 you're an adult, but Riley's an example, incredibly emotionally intelligent and incredibly mature. But emotionally, because of the trauma they've had, most of them are 12 or 13 with how they maybe think or feel. Trying to navigate at 18 the world on your own, paying your own bills, getting your own food, just coping with no family around you. And if you do, often that's the family you were removed from as a child, at which point they're not the best role models.
Abby is a part-time nurse that works with over 1,000 care leavers, so she is available to them if they should need her. Luckily, they don't always need her all at one time because it's a massive caseload across Pan Dorset, and that's the shift that we've made. So it used to be that there was 2 days a week in BCP area and then 2 days a week in Dorset, and there was quite an inequity in the services being delivered, so we combined it, and Abby now works across the 2 patches.
Some of my young people are people that society hear about in the newspapers. They're the ones that no one wants to spend time with. But actually, when you get past that wall and their language and how they communicate, 'cause they test you. But once you're behind that, it is so privileged to be with a young person who asks for help and actually are so grateful when you've done something that to me is really simple. But to them, they're like, no one's ever listened to me and actually followed through and come back. And to me, I'm like, that's such a tiny thing to do, but to them, they've never had that as a child.
Following feedback from our staff and Ulysses reports, we'd identified that it was taking a long period of time for dressings to get to a patient after the patient had been assessed by the staff. This is mainly due to the fact that the teams need to arrange prescriptions. The prescriptions then need to be dispensed by the chemists, and then it often took some time for those products to get to the patient's house. This was also a delay in treatment for the patient, but also meant that staff were taking a lot of time trying to chase up prescriptions to make sure dressings were in the house when they arrived.
The impact on staff with the situation it was before was it was quite frustrating. Staff from our module on our electronic system, staff couldn't see which chemist had the script had gone to, so even chasing up a script took a lot of time because it was the background work to it. And on a survey, it was estimated that staff on average spent 2.4 hours per week chasing prescriptions.
We then looked at another alternative way of supplying wound care products. So instead of arranging our products via a prescription via the general practitioner, we then looked at an electronic ordering system. This would mean we could keep base stock actually where the teams are, so they could take in dressings as and when they needed them. And they'd also have a small selection in their car so that they could react to any changes in wounds at the time of the visit. And this hopefully would mean less time spent chasing up prescriptions, as they would have full control of restocking their cupboards.
The expected improvement for staff will be that the whole sort of system, from assessment, ordering what you need, getting it in for the patient, being able to put the dressing on a wound, would be that would be a lot quicker process, less frustrating, and because of the reduction of chasing other processes on, they would have more clinical time, which is absolutely key.
In conclusion, the pilot's just beginning. It's a 1-year pilot with a company providing us with an electronic ordering system. We're not anticipating any cost savings from the pilot, but we are hoping that this will be cost neutral. But there should be huge benefits to patients in the fact that they get their wound care products that they need much quicker, and for our staff that they will then have more time available to provide clinical care rather than ordering dressings and chasing up dressings to make sure they're in the home at the right time.
Volunteers, really they are a great value to the unit. What they do is helping us with patients, especially with the breakfast in the morning, and also they've got that time. They've got more time to sit with the patients, talk to them, especially those who are frail. They need somebody to talk to.
When you're just looking at a textbook, it's just the word patients, but when you're actually getting an experience, you know, you can share stories with them, they can tell you about their experience, and it just kind of makes you relate to them more. Because they often say that they want to go home, and I mean, that's a concept everyone can relate to.
I think the most important thing is the happiness of the patients. So you can, every time you see the volunteers coming in and having a chat with the patients, you can see the happiness, and they feel like someone is really help them, and they can see that we really care about them. I know sometimes it's hard even for us as nurses to have time to spend with them, more time to spend with them. But yeah, the volunteers, they are great in what they are doing, and they give us quite a lot of help on the ward.
If there's anything I'm unsure about, they can always help me, like where the cups are in the kitchen, or which patients need the feeder and which don't. And it's just a nice, kind of environment here. I wanted to have a career in medicine for a pretty long time now, but I think it's just solidified the, you know, the inspiration to get a job in healthcare.
It's really amazing and rewarding because some of my volunteers, they've got the jobs. Some they've become like coordinators. Some, one of my volunteer is now a doctor. So we are proud of that.
Except for like opening your eyes on healthcare, it just generally opens your eyes on life. Just kind of makes you appreciate it more, I guess.
One of my patients, I was in tears crying when I told her that one of my volunteers is not coming anymore because he got a permanent job.
It's kind of a nice routine because you get to go around the whole of the ward and talk to all of the patients. And they love teaching you how to make tea.
Thank you for that. I always find the patient story and seeing what our teams do the most satisfying part of the role that I do at Dorset Healthcare. So can I just say a sincere thanks to the Care Leavers team and Riley in particular. Could I thank Jenny and Hattie for what they're doing with the district nursing team and that change and improvement they're driving. To Precious and the team at Alderney, her passion for what she does there is amazing, as the work of her team. And to Sophia and amazing volunteers, thank you very, very much. We now move on to kind of just a short bit of kind of me setting the scene for some other stuff that's coming in the annual members meeting. So first of all, I'd just like to, just looking forward a little bit, COVID has really impacted it to a large extent on how the health service and our teams have been managing risk. And for our teams, although the rest of us outside in society are not having to take the same kind of precautions that we once were, our teams are still having to work with protective equipment. And I've not spent much time in that kit, but when on those occasions when I do, it is so energy sapping and it's hot and it's uncomfortable and it makes the job that they do even more difficult. So can we just bear that in mind, and my thanks to everybody that still does that to keep our patients safe. Also, the waves of COVID also make it quite unpredictable. So we kind of step down our protection and then have to then put it up again. So that kind of creates problems for the delivery of service. And I'd just like to recognise that we understand that that is frustrating. To counter that, we are desperately trying to support our staff in as many ways as possible. And with wellbeing offers, etc., we hope that as many staff as possible will be accessing that, because when our teams are well, then our patients get even better treatment. One of the very, very small things that we've done is sent a coffee van around different locations in Dorset. And the Chief Exec and I have basically followed the coffee van. And so we've done this just to get that opportunity to talk to our teams. You might say when there's a big queue, so St Anne's, for instance, in Alderney, there was a lovely day and there was great queues of people at the coffee van. The Chief Exec and I could have said, actually, they'd come to see us, but the reality is they'd come for the coffee and they just had to talk to us because we were there. So my thanks to everybody for giving us an insight into the work that you are doing. We really do appreciate that we don't get everything right at Dorset Healthcare, and those conversations are really important so that the Chief Exec, the exec team, and myself and the board understand where we can be better every day. So my thanks, and please keep those conversations coming. I'd quite like to use a kind of some reflections upon those conversations. So some of our teams are really small, and one of the really small teams is the deep cleaning team. And the deep cleaning team has been incredibly important in the pandemic. They're a small group, they've had to be versatile, they've had to be flexible, and they've been working in quite intense positions. And just getting the, and they don't get paid vast amounts of money, let's be honest about this, okay? The dedication to Dorset Healthcare and the commitment to keeping our patients safe was just fantastic. So to those of you that spoke to Dawn and I, our sincere thanks. One of the services that has been incredibly dynamic has been our sexual health services, and I'd just like to mention them for just a couple of minutes. Dawn and I went to visit them a couple of weeks ago, and I'd been pre-pandemic as well. And what struck us that we talk about collaboration in the health service a lot, and the idea of collaboration is that patients don't feel that there are distinct bits of the pathway when they get treated. And what was really evident from the sexual health team is that bringing together services that were once in University Hospitals Dorset and Dorset County Hospital and ourselves into one service has really allowed us to not only increase the quality of the service offered, but also to be able to manage new challenges. And the classic new challenge has been the monkeypox. And talking to the team there, that working from one location and with an integrated offer has really helped us to respond to that situation. The other inspiring bit of the service we offer is the working women's van, which a small committed group of ladies go out in that van in the evening and support working women with their health and other things that will keep them safe. And sometimes it's just listening and being that assurance to people that are having to deal with very, very difficult situations. So my sincere thanks for them. And this collaboration across organisations has led us at Dorset Healthcare and Dorset County Hospital to think, so what else could we do to help the collaboration across organisations so that patients benefit, so that patients don't see a gap between one service being offered by one organisation and another. And what we've come to the view is that both boards have said it will be better for patients if we have a joint chief exec and a joint chair. That will allow us to have one view of what good looks like, to make things better for patients in a collective rather than in two organisations taking a different view. The plan for that is that by hopefully Christmas, we will have chosen a substantive chief executive to take the organisation forward, and then we will start looking for a joint chair of the two organisations. I would just like to say to my colleagues at Dorset County Hospital, your commitment to that process and working with you on that process has been an incredibly positive experience for me, and to Mark Addison, the chair of that organisation, my sincere thanks, and his chief executive and board. And finally, I'd just like to mention the vaccination service. Well, you know, we're 2.5 years down the tracks now on this, and you have done a fantastic job. We are now at Dorset Healthcare the lead provider for the vaccination service in Dorset, and I'm really proud to say we are a little bit ahead of the game compared with other counties. And so that has been because of the passion and commitment of that team, the willingness to innovate, okay? And we are now kind of in the last round, we got pop-up clinics and we used Sentinel House as a vaccination centre. And now we're in the rollout of the next part of the vaccination programme this winter. And that's in collaboration with primary care and pharmacies. So, you know, using pharmacies and primary care to deliver the service will make it more accessible and local to patients. I'd also like to thank not only our staff for that vaccination programme, but the absolutely amazing volunteers that have given their time, hour after hour, giving support to people that were quite often quite nervous about the vaccination and needed support. It wasn't just about jabbing in the arm. There's a lot more involved in that process. So my thanks to those volunteers. And very finally, even giving a vaccination needs some innovation. And the sensory room at Kings Park, I think, is an example of that. Not everybody is comfortable having a vaccination. Those with learning disabilities find it an incredibly stressful experience. Those with mental health difficulties can find it stressful. And children, it's not a nice thing to have something stuck in your arm. And that sensory room has really brought innovation into calming people before they have vaccinations. And that has been recognised by a shortlisting of the Nursing Times National Awards. So that is fantastic and well done to that team. I'm going to finish off by saying delivery of services to patients is about collaboration and partnership. I'd like to thank our teams for the way you collaborate with each other across different parts of the pathway, to our patients for your support in helping us collaborate with you and giving feedback on where we can do things better, to carers who support our patients, and then finally to volunteers and other organisations in Dorset that collaborate for the benefit of patients. Thank you everyone for working with us, okay, and becoming better every day. I'd now like to just kind of do a little bit of organisation pieces, if I may. First of all, you will see on the screen there's a question and answer facility. At the end of the session, or near the back end of the session, we're going to give an opportunity to do Q&A. If you would put your questions in that as we go through the annual members meeting, that will allow us to collate them. And then in the question and answer session, we will have Nicola Plum, who will be leading and coordinating the questions. Clearly, if several questions are asked by several different people, then we won't ask every question, we'll be taking themes from them. So if you would put the questions in there as we go, that would be absolutely brilliant. We're also going to try something different, which is going to be Slido. Now, I've used this before. It's a great way of getting feedback, and our governors are really keen on you giving some feedback on some key questions. The best way of accessing Slido is if you've got another computer or even a mobile phone, okay, then that will allow you to interact quicker and easier. So we'll come on to the detail of that, but if you have a mobile phone available, please find it, dig it out, turn it on, and we'll come to that later on. So I think we now go on to a little bit more looking forward. Dawn Dawson, the acting CEO, unfortunately isn't with us today, but she wouldn't want this meeting to occur without her being in the room. So she's left us a video about Dorset Healthcare and looking forward. So over to Dawn and her video.
I feel very privileged and proud as the acting chief executive to be able to look back on everything we've achieved together and to look ahead to some of the exciting developments coming down the line. Over the last year, we've continued to face the ongoing challenges caused by the COVID-19 pandemic. What's been really remarkable, though, is the way we've adapted and evolved to ensure we can provide the best possible care and support to all the people we serve. Many of the changes we had already made to the way we delivered services the previous year have remained in place this year. We've also developed some new services, such as our vaccination programme, alongside running our business as usual services in innovative new ways to keep our colleagues, patients and service users safe. Our focus on outstanding quality service has pushed us forward. While the pandemic has been disruptive, it's also accelerated the pace of change in many ways and allowed us to look at things differently. In particular, the use of digital solutions has supported us to be agile and creative. During my visits to teams across the Trust, I've been truly moved by the dedication and commitment of colleagues who have continued to provide outstanding quality care throughout this period of unprecedented challenge. Recovery from several pandemic waves has been difficult and not progressed in line with plans in a number of services. This has largely been due to COVID-19 outbreaks and staffing challenges, both within the Trust and across the Dorset system. This has been and remains a priority area of focus for the Trust, as well as ensuring that we support our staff to look after themselves and to recover from the effects of sustained pressure they have faced. I'd like to talk a little more about our colleagues. They really have astounded me with their can-do attitude, resilience and unstinting focus on patients and service users. The Chairman and I have heard so many stories from teams who have been heavily impacted by staff shortages, increased demand and the relentless pace of delivery and change. I don't underestimate the toll this has taken, which is why our drive to support our workforce is so very important. We're working hard to improve flexibility for our colleagues, easier in some roles than others, but important to everyone to achieve a good life-work balance. We also have a comprehensive learning and development programme and are working to keep developing interesting and fulfilling career pathways that help our colleagues grow, move and stay within our organisation. Recruitment is challenging for all NHS trusts, and we've put additional resource and energy into attracting the best people to work for Dorset Healthcare. This includes everything from online recruitment fairs to welcoming new overseas colleagues into our teams. And we'll continue to use innovative tactics to bring the right people into our organisation. Despite the disruption and the challenges, our drive to be better every day has progressed this year, with some really wonderful successes to celebrate. We've continued to deliver the COVID-19 vaccination service, with Dorset Healthcare taking a lead provider role and driving the pre-Christmas booster programme in 2021, as well as this year's spring and autumn boosters. We began work on a new state-of-the-art eating disorders building at St Anne's Hospital in Poole. This £8 million development is due to be completed next year and will reduce the need to place patients out of their home area. The unit will have 10 inpatient beds and will also offer day care treatment. We offer the Weymouth Community Front Room Mental Health Drop-in Centre. These facilities really are a game changer for people who are struggling to cope when they're feeling stressed, anxious or depressed. This is a great partnership project with Bournemouth Churches Housing Association, very much in line with our drive to work closely with others to provide the right services in the right places. We also rolled out a new confidential text messaging service to support parents and carers of children aged 5 and under. Run by our health visiting team, the service offers guidance about children's health and development in those all-important early years. We launched our Op Courage mental health services for Forces veterans and were accredited as a veteran-aware trust. Whether someone has just left the armed forces or finished their service years ago, they can access support from people who understand military life and can ensure they have the right type of specialist care. We completed the refurbishment of Swanage Community Hospital. Thanks to £1.2 million of funding from the hospital's tireless League of Friends, we've improved the facility, creating a therapeutic patient garden, an accessible lift from the ward area, a rest area for staff, ensuite accommodation for carers of patients receiving end-of-life care, and a new patient lounge. We have widened access to our children and adolescents mental health gateway service to young people in the west of Dorset, after a successful launch earlier in the east. The service gives young people aged 16 to 18 the option to refer themselves online rather than going through their GP. This important service supports local young people with a variety of mental health issues, including depression, anxiety, isolation and self-image. We joined forces with Dorset County Hospital to develop ultrasound facilities at Weymouth Community Hospital. The £150,000 improvements mean people in the Weymouth area can access their scan locally without having to travel to Dorchester, reducing waiting times and increasing capacity. We set up a new confidential sexual health text messaging service for young people aged 13 to 19. The service offers advice and information on topics like emergency contraception, unplanned pregnancy, and sexually transmitted diseases. This is only really a snapshot of the many projects, programmes, and service developments we have progressed during 21-22. All of these fantastic achievements demonstrate the many and varied ways in which we are empowering people to make the most of their lives and supporting them to access the services they need in ways which work for them. They also show how we are working collaboratively with our partners in the Dorset health and care system, with our thriving voluntary and community sector, and with the people and the communities of Dorset. Joining up our services, making health and care easier to navigate, and working across organisations wherever possible is the way we can best support our communities. Working in this way will also provide the best value for money and get the most out of the limited resources available. With the establishment in law of the integrated care systems, we have a clear drive towards seeking every possible opportunity to work even more closely together. We at Dorset Healthcare are an active partner, committed to playing a leading role in imagining and delivering the health services of the future. We have strong representation on the Provider Collaborative for Dorset, which will drive forward our clinical services, and we will be closely involved in all aspects of the ongoing journey of our Dorset integrated care system. In addition to this wider system work, the boards of Dorset Healthcare and Dorset County Hospital have agreed to appoint both a joint chief executive and a joint chair for our two trusts. We firmly believe that this new arrangement will simplify decision making, increase integration, and most importantly, improve care for patients and outcomes. Once again, Dorset is trying something new. There are very few examples of a community and mental health trust collaborating in this way with an acute provider. And whilst we are not merging the organisations, we expect this new way of working to bring a real dividend and to make a huge difference for local people. As we move into the next phase of Dorset Healthcare's journey, we know we need to be bold and step out of our comfort zone. If the pandemic has taught us anything, it's that necessity is the mother of invention. Free from the restraints of the way things have always been done, we can start to imagine a new path. Our internal reboot campaign has given us the space to reflect, reset, and re-energise ourselves for the future. We know there's much more we can do, and that the pressure on our colleagues continues as we move into the more challenging winter period. One way we can tackle challenges at a large scale is through our transformation programme. In its second year during 2021 and 22, it's coordinating and driving the changes we need to achieve our strategic ambitions and deliver better care to our patients. It brings all change programmes together, aligning them with our quality improvement model, empowering teams to implement the changes that will make a real and positive difference to the quality of care they provide in a post-pandemic world. We have identified our initial priority projects, which will focus on developing a proactive service for frail elderly patients, redesigning our urgent care services, improving the flow through mental health inpatient services, transforming community mental health services, and reimagining our child and adolescent mental health services. And I'm pleased to say we are already making good progress with focused, targeted work to identify the change that will make a real difference for our patients and for our staff. We're also delighted to have won funding from the government as part of their new hospitals programme. This will enable us to build a new psychiatric intensive care unit for children and young people at Allenhurst Road in Bournemouth. Providing very specialist services, the unit will support young people who are seriously unwell and would otherwise be placed in a unit far out of their home area. It was fantastic to see our revised plans on display recently and to speak with local residents to explain the difference this will make. We are also working on plans to improve the inpatient facilities at St Anne's Hospital in Poole. It is a testament to our track record of delivering outstanding services that we've been able to attract national investment on this scale. Once again, Dorset is at the forefront of modern, innovative, patient-focused services and facilities that help people make the most of their lives. As we move into the more challenging winter period, we know that the cost of living crisis is really starting to impact many of our staff, alongside many members of the community. For colleagues, we have a range of measures in place, including help available through our Staff Support Fund. We know that financial worries can ultimately also have health impacts for our local population, and we will work with our partners to help mitigate these impacts and support people to stay well. I'd like my final words to go to our patients, carers, volunteers, and communities. We are here to serve them, and we can only create and deliver the services they need by listening and threading their voice into everything we do. The pandemic has been tough on everyone, but for the many patients whose treatments have been delayed and the carers who have been unable to visit when hospitals were locked down, it's been even tougher. Hearing and understanding the impact on them is central to the way we need to go forward. Equally, the pandemic has helped to spark a renewed community spirit. The massive volunteer effort supporting the vaccination programme, for example, has been a joy to behold. People from all walks of life have freely given their time and effort to help others in their hour of need. Communities have stepped up, collecting prescriptions and shopping for elderly neighbours, checking in on each other and reminding us how much we all need each other. That team spirit is what has kept us going, and we will continue to foster it inside our organisation and outside it as we follow on our mission to support people to make the most of their lives.
Thank you, Dawn. As I said, Dawn couldn't be with us today, but I'd just like to kind of reinforce what she said in terms of our teams and colleagues who have just done amazing stuff to keep the wheels on the NHS as we've been through the last 12 to 18 months. And I know they will do amazing things over coming months as well as we head into winter. Now moving on to our Council of Governors. So our Council of Governors is what holds us to account to the population we serve, and also we're very lucky in that they are incredibly supportive of the organisation and what it's trying to achieve for the benefit of patients. We have today a couple of colleagues that are going to speak to you. Margaret and Dave are part of the Council of Governors team. We don't have a lead governor, some Foundation Trust do, but Margaret and Dave have kindly agreed to do a video, an update from the council's point of view of what we're trying to achieve at Dorset Healthcare. So over to Margaret and Dave. Thank you.
Thank you, Chair. I'm really pleased to represent the Council of Governors at our annual members meeting this year. Until the summer, the Council of Governors continues to meet virtually due to the impact of the COVID-19 pandemic. Although this is not the way we prefer to conduct our business, we have been able to hold both formal meetings and informal sessions where governors could share feedback and any concerns they have heard from members of the public. Virtual meetings have made it easier for governors to attend and observe board and committee meetings during the year, removing the cost and environmental impact of travel. We have received information about the performance of the Trust and had oversight of the challenges the Trust has been tackling. This has enabled us to give feedback to the board and provide effective challenge. Our second virtual annual members meeting took place in October 2021 and was attended by over 130 people. We looked at how the Trust had adapted services to continue to provide the support that so many people value and need. We explored how Dorset Healthcare is developing services for the future, which continue to empower people to make the most of their lives. Despite the challenges, there's been a lot to celebrate for our patients and our staff. We have continued to develop the shared leadership model for the Council of Governors through 3 teams: the lead governor team, the council development team, and the membership team. Leading the council together in this way means we involve more governors and bring a wide range of perspectives and skills to everything we do. This approach has continued to work well for us and has allowed us to be flexible and resilient as we support the Trust. Before I hand over to my colleague, I would just like to say thank you and farewell to the governors who have left us in the past year. We wish you all the best and are very grateful to you for your service. The Council of Governors has also been involved in the reappointment of one existing non-executive director and the appointment of 2 new non-executive directors who joined the Trust at the beginning of September.
Thank you, Dave. I'm delighted to have been re-elected and to help present the Council of Governors report. Much like the Trust as a whole, the Council of Governors continues to seek out new ways of working and new opportunities to engage with local people and find out what matters most to them. In the coming year with our membership team, we'll be working hard to deliver our new membership and engagement strategy. This aims to ensure that the Trust has a membership that represents our local population and the communities we serve. We want to help ensure that members, staff, and the public are fully informed, engaged, and involved in decisions about the Trust strategy and plans for the future. Working in line with Dorset Healthcare's public engagement strategy, we're aiming to be more creative and proactive in seeking people's views about their priorities and needs for healthcare services in our communities. We'll be looking to build on established channels like our quarterly members newsletter and create more opportunities for two-way communication with our members. We will be planning engagement sessions at local levels so that you can get to know your governors a little better. And most importantly, share your experiences, the good and perhaps the not so good, areas where we didn't meet your expectations or where we can improve. We need to hear from you. Your views are important to us. Share your voice. We can only get better together. As always, it will be important for us to work as part of the Dorset Integrated Care System, joining up with our partner organizations as much as possible, including Dorset County Hospital, as the Trust continue their collaboration with the appointment of a joint chair and chief executive. We want to ensure that all of our communities are well represented in discussions and planning for health and care services. We really would like to hear from as many people as possible. Please do get in touch with governors to share your thoughts and experiences of healthcare service in Dorset by emailing. If you're not yet a member of Dorset Healthcare, you can join online by visiting our website at dorsethealthcare.nhs.uk and going to the Get Involved tab. Finally, I'd like to welcome a number of new governors who have joined us, particularly those joining us from today. I'm sure you will find this a really rewarding experience, and I look forward to working with you in the coming weeks and months. Thank you.
So I now, and before I move on, I'd just like to say to the Council of Governors, you always bring your constructive challenge to the board in a way that really represents the interests of people, our teams within the organisation and the community at large, for which I personally and the rest of the board thank you. And I think the development of the outreach now that COVID is over to bring those voices into the organisation will be incredibly helpful.
The first question was about how the Trust is working across Dorset on health inequalities, and specifically talking about how we're working with our partners in the integrated care system, which is our health and social care partners, so the NHS and local government, our community partners, voluntary sector and others, to improve access and promote health and wellbeing of communities and individuals. Our lead director for that is our medical director, Faisal, and he will answer that now for us. Thank you.
Hi Nicola, can I just check that you can hear me? Oh, that's brilliant. Okay, that's a good start. Hi colleagues, I just wanted to say first of all that the pandemic has shone a real light on the impact of existing health inequalities. When we think about health inequalities, there's all sorts of modifiable factors that influence our health. There's so many of them, and some of them we can influence directly. So I'm thinking about things like, you know, how we provide mental health care, or significant things like smoking cessation support. Other things we can't influence alone. We need a much broader influence, and I'm thinking about things like access to really high quality housing, and that requires collaborative work across the system. So in our trust, we've established a health inequalities working group, and it's developing relationships with the Dorset Integrated Care System, the ICS, so that we're aligning our approaches to reducing health inequalities. We all know that some parts of the county, Dorset, are notable for areas of inequity, and that working group that's now really fully formed is beginning to promote the use of something called the Health Equity Audit Tool to look at the distribution of inequity in health, for example, as you say, by geography and what causes it. It's really, really early days in the integrated care system, the ICS, and we'll be working closely with our partners in the ICS to look at these health inequalities, reduce them, and we'll do that by understanding the lived experience of different communities in Dorset. There's two things that I will highlight. One in particular is there's a renewed focus now on how we collaborate and work closely with our primary care colleagues so that we improve access to community services. And that's because to tackle the causes of health inequality, we need to focus really on prevention and early intervention. And most of that happens in the community and out of hospital, and needs close working with all our partners in the system. And just to also say, we've also committed in our organisation to recruiting a public health consultant to lead our approach to tackling health inequalities and improving population health in the system. So I hope that gives a really broad overview, Nicola. And if other people want to ask more or find out more, I'm more than happy to be contacted outside of this meeting.
Thanks very much, Faisal. Thank you. And I can see we've got another question in, so we'll run through the questions we've had in advance, and then we'll come to our live questions. Thank you. The next question we've got here is about our fully qualified advanced clinical practitioners. I'm going to ask Cara Southgate to answer this, who is our acting Chief Nursing Officer, and this is about the banding for these roles in line with the National Health Education England framework. So thanks, Cara, over to you.
Thank you, Nicola, and thank you for the question. I'm incredibly proud of our advanced clinical practitioners in Dorset Healthcare. The programme is hard, and the course to get there is a long journey to get to be an advanced clinical practitioner. So firstly, I'd like to say how proud I am of them. We've been working over the past year to develop an advanced clinical practice framework for Dorset Healthcare. And I hope that this will give clarity on workforce development and align our advanced clinical practitioners with Health Education England's pathway. This work has been clinically led by advanced clinical practitioners and sponsored by myself, and it is now in the final stages of sign-on. We recognise, and I do, that we have a number of advanced clinical practitioners in roles across our organisation, and we'll be making contact with them shortly on an individual basis to talk about their personal circumstances. Thank you. Thank you, Nicola.
Thanks, Cara. So we've got two final questions here for our Chief Operating Officer and Deputy Chief Executive, Chris Dominy. The first is about mental health services and what are the options here. How can we get any additional funding, and how do we tackle the waiting lists that we know still exist, described here as the unreasonable waiting lists for mental health? So that's the first one about our mental health services. And then there is also a question which I will also ask Chris to answer, which is about Weymouth Urgent Care Centre and why that cannot return to being a sit and wait service like the local emergency departments. So Chris, thank you. I'll hand over to you.
Thank you. Thanks very much for the two questions. I'll address the one for mental health first, if that's okay. The way that mental health services are planned is through what is known as the long-term plan for mental health. And delivering the long-term plan comes with it a mental health investment standard and some transformation money, which we use to implement the requirements of the long-term plan. The mental health investment standard does grow on year, but it is allocated to very specific activities that we are monitored and managed against. And what we try to do is to use that money in the best possible way, understanding the needs of our patients across Dorset, and deliver services that are accordingly designed according to the needs of the population. Where we do have pressures, and we know that we do have significant pressures, the pandemic has increased the rate of referral for different parts of our system. We continue to seek out new funding opportunities and develop business cases which are designed to meet those particular needs. It's really important to us in particular that we use the resources that we have to their best effect. And we are working hard to transform our community services at the moment to make sure that we can address the service users' needs as close to home as possible. There are a number of patients who are waiting, and we are continually looking at different ways to develop services so that we can reduce any waiting times as much as we possibly can by transforming our services to be more in line with what the presenting needs are. I fully appreciate and understand that for some people waiting is incredibly difficult, and this is particularly true for children and young people. So we continue to make the best of the resources that we actually get. We lobby for as much money as we possibly can, and we continue to transform our services to meet the needs of the local populations wherever possible. That's the first question. The second question that I've got is about Weymouth Urgent Care Centre going back to a sit and wait service, such as people find in the A&Es. So the changes that have been made across urgent care services are part of a national drive to get people to be treated in the right place at the right time. Not everybody needs to go to A&E, not everybody needs to go to an urgent treatment centre. And the move from the national NHSE is for patients to call 111 first when they need some help, and for us to be able to target that help and support in the right place. What the 111 service can do is book people into the right place to receive the right type of care for what they are presenting with. And we can give patients appointment times for them to be seen at a time that is convenient for them, but also in a location that is convenient for where they live. We are still avoiding overcrowding as the COVID numbers are beginning to increase again, and we are always trying to be responsive to spikes in COVID across the county. So having patients sitting for long periods of time in waiting areas is not the most ideal for spreading the infection. So it is still important for us to be able to offer those appointments at a time that the patient can go to that service for an appointment very specifically. If people continue to attend the MIUs and the UTCs, of course they will be seen, but it may not be the best place for them to be treated with a particular issue, and they will be directed elsewhere or given an appointment later in the day to be seen. It is a change, and we do know that, and for some people this change is not as welcome as some of the other changes that we are making. But this is the direction of travel that the government are asking us to make, and we continue to try our best to see patients who need it as soon as possible. Thank you.
Okay, and thanks very much, Chris. So we have got a final question which has been published, and I'm going to hand back to Andy Willis to answer that for us. Andy, after you've responded to the question about the Joint Chief Executive and Chair, we are going to jump back into the planned agenda. So we will then go to, all being well, the report of the Council of Governors, onto the Slido piece, and then into our presentation from Matthew Metcalf. If there are any questions that do arise from the remainder of the meeting, then we will receive those in the Q&A, live event Q&A, and we can pick those up. So I'll pass now to Andy before we go back into the agenda. Thank you.
Thank you, Nicola. As ever, well done for picking up. We always rely upon you to smooth over the glitches, so thank you. On to the question. I think it's Carrie has asked this question. So, and the question is the idea of having a joint chair and joint chief exec something to do with a merger like happened at University Hospitals Dorset? I can be absolutely clear on this, okay? And I've said it, I think, in most of the communications within the organisation. This is driven by patient benefit and pathway redesign. I have a mother that needs care, and I get frustrated when handoffs between organisations impact upon the quality of that care and her ability to navigate it. Therefore, this is a real attempt to say, if we put patients at the centre of this, what would improve the patient journey? First of all, we would identify areas where collaboration can be more effective by with the two organisations across community and mental health care and acute care, which we have done, and we've got our clinicians working on programmes around that. And then the second part of the question that the boards have addressed themselves to, is there anything that we can do to help that process be quicker and more effective? And we have come to the view that if you have a chair and a chief exec that is common to both organisations, then that will help them align. So I hope that is absolutely clear. It is not my intention in supporting this that this leads to a merger. And I do not believe that is the intention either of the board of Dorset County Hospital, but I will leave that for others to determine. But I'm absolutely sure that's the case. So I hope that's clear enough. So I think and I'm really happy to have a conversation around that with anybody if they would like to. So now I'd like to pass over, please, to another part of the Governor team, Becky Aldridge and Stephen Churchill, who are going to run Slido seamlessly, and I will shut up and hand over to Becky and team. Over to you guys.
Thank you, Chair. Hello, I'm Becky Aldridge and I'm a Partner Governor for Dorset Healthcare. We're really pleased to be able to introduce a new section to the annual members meeting. Further to what Andy's been saying and Dawn and Margaret just now, it's really important to us as a council that we gather your views. And as you've just heard from the report, we're really keen to hear from more members and as many people as possible and the public as a whole. So we'd like to take this opportunity to find out from you which services and topics are of most interest to you and how you'd like to engage with us in the future. And this will help us to plan and prioritise our activities in the coming year, not just the council, but also the organisation as a whole around engagement. Over to you, Stephen.
Thank you very much, Becky. My name is Stephen Churchill and I am a staff governor. So hopefully on the screen you can see the Slido poll in front of you. Now, to take part, what you need to do is to go to slido.com, either on a mobile device, so if you've got a smartphone or a tablet, or if you want to open another tab in your internet browser on your computer, you can access Slido that way. So slido.com. And once you have the website in front of you, please put in the code that you can see on the screen there. I'll just read it out, 1887064, and that will allow you to access our poll. Now, if you're really techie and you have a QR code reader on your mobile device, you can also go to your camera and scan the QR code that you can see here on the screen, and that will take you straight to our poll. So we'll just give you a few seconds to go into the poll via your preferred route.
So our first question aims to find out a little about the things that you started to do differently around your health as a result of the pandemic. On your Slido, on Slido on your device, you should now be able to see the first question. And here it is. What have you changed in your health habits following the pandemic or for other reasons? Now, on your device, you should be able to select an option or several options. That's great, thank you. And what we can see is people starting to complete the questions and answer the questions. You can select as many as you like. So a lot of people are saying that they're getting out more for some fresh air and exercise in their local area. You're able to see the bars moving as people are giving us different answers. People have the bars are moving so quickly I can't keep up. Look.
It's a bit like the Eurovision Song Contest.
Oh, it
Becky.
is, isn't it? Oh, I'm scared now. So I think it's fantastic that everyone's using it and completing it, because that actually gives us a real opportunity to see what people are thinking and kind of feeling and how behaviours have changed. And I like this one about I've called 111 rather than going to an emergency department. That's really important for Dorset Healthcare in terms of people's engagement with 111. And this information will be really helpful to the exec team and to all the operational teams in terms of informing and shaping what they do. I found it more convenient to have online or telephone appointments with health professionals, 47%. That's quite a high percentage. And I'm much more aware of my mental and emotional health and take steps to support myself. 47% of people are saying that as well. So I think that's really, really interesting. I don't know whether whoever's got control of the Slido, can you slide down to the bottom so we can see what's on the bottom of it? Well done, fantastic. I've improved the way I self-manage my health condition, 19%. Well, I think that's pretty good as well, and that's really interesting, and certainly a really interesting dialogue that professionals will want to have with people as well. I think this is a really useful exercise. Thank you, everyone, for taking the time to complete that. Stephen, over to you for the next question.
Thank you, Becky. And I think just picking up on what you said there about this is helpful information for the executive, it's also going to be really valuable for the governors to look at and consider as well in terms of how it informs our engagement with our service users and the public as well. So thank you very much for taking the time to provide your feedback. So we're now moving on to question 2. Now, this isn't a complete list of all our services, of course, because Dorset Healthcare is a very big organisation, but we'd like to find out which of these you're most interested in finding out a little bit more about. And then we can use these as topics for our engagement events that we organise in the future. And people are way ahead of me here. They're voting already. This is great. So thank you. So which of Dorset Healthcare service areas are you most interested in hearing more about? So there's a lot of options there for you to consider, and you can vote for more than one. And of course, in the context of COVID, a lot of service provision has changed over recent years. So what may have been traditional in the sense of how services were provided is a lot different now, and plenty of opportunity there for you to learn more about how services are delivered to the people of Dorset, and not forgetting, of course, our little outpost in Southampton with the Steps to Wellbeing service. So I think it's really interesting there that we've got urgent care services at the top of the charts, and closely followed by our mental health services as well. It's quite a sort of even spread, I would say, Becky, there that we're seeing.
Yeah, I think so. And also what's great is that actually our members and attendees want to find out about all of these things. And from our point of view as a council, that's going to really help to shape our engagement activities and how we can actually get information out to people around all of these things. So again, brilliant to actually have that engagement with that question. I think people have finished, and I don't think there's any areas where people aren't particularly interested. It feels like people are interested in everything, which is again really helpful information for the implementation of our membership and engagement strategy.
Definitely, and I think it just is a reflection as well of how the trust reaches out to the people in the county in so many different areas.
Yeah.
But it's great that we've got that interest across the board. So thank you for your input into question 2. So I'm now going to hand back over to Becky for question number 3.
Okay, thanks, Stephen. So this is the final question, and this question aims to find out the best way for us as a council and as governors to interact with you. So what we'd like to know is how you would like Dorset Healthcare's governors to engage with you, and there's a range of different options here. So I think Margaret mentioned earlier on the regular information in the members news letter quarterly. We've talked about in-person events. They've been really popular in the past. There's obviously online events. People have mixed views about online. It works great for some people, not for others. Surveys and polls. Some people like surveys and polls. I think there's lots and lots of different ways that the council can engage with people, and finding out your views and preferences is really, really helpful. And look at those sliders go. I'm loving this. I have to say, I'm really enjoying this. And it's great to kind of get that sense of interaction and seeing all the things and seeing it moving and seeing people and all the different the different ideas that people are having and the level of engagement. And again, Stephen, you know, what we've got is give us all of it.
Exactly, yeah.
Yeah, and there's a broad range of things, which I guess is kind of what we all know, isn't it? That, you know, different people like different things, and different things work for different people, and that's, you know, that's great. And again, sliding down, I can't see anything that people don't like at all. So that kind of tells us what we need to know, doesn't it?
I think it does. It doesn't tell us anything that we didn't know, but it's just reinforces the fact that we need as many channels as possible on the go to really reach out to people, and so that they can feel heard.
I think so, and there's a good spread there too across, and it's a relatively even spread in terms of different mechanisms. So we'll be working with the comms and engagement team to support us with these engagement mechanisms and working that through. So really great, and again really helpful. Thank you to everybody for contributing with that, and for managing Slido. New technology is not easy.
It's great, isn't it? I'll just echo that, Becky, and just thank you to everyone who's joined us this evening, and thank you for taking part in the poll. If you had any issues accessing Slido at all, then we're going to leave it open for another week or so, and you'll be able to answer the questions in your own time. We will also put the Slido link and the code in the Q&A chat box for you as well. So if you haven't had the opportunity yet to put in your feedback, then you've got some time to do that. So I think that wraps things up for us. So thank you again, and I will now hand back to the chair to continue the rest of the meeting.
Thank you, Becky and Stephen. I always like Slido. It makes it just a little bit more dynamic and interactive. So very well done, and we look forward to getting that data in due course. So Matthew is our finance director, or chief financial officer, as we now call him, and he's going to give a quick summary of where we've got to on the finances. Matthew, over to you. Thank you.
Thanks, Andy. So we've heard a lot this afternoon about what Dorset Healthcare has been doing to improve services for our patients. But there's the other side of the coin as well, which is always the money, the bit certainly I spend all my time worrying about. But I'm pleased to report that we're doing okay on the money, certainly in 21-22, which is against the sort of more general backdrop in which we're operating at the moment. It is really pleasing to see. The first thing to really provide some assurance around all of that is we had an audit of our 21-22 accounts for the year ended 31st March 22, which gave us a very clean audit opinion from KPMG, our external auditors appointed by the governors. And not only that, they did a value for money review, which tells us that we also achieved everything we were expected, or that was expected of us in relation to value for money. So not only thinking about patients, but really also acting like taxpayers. To give a little bit more colour around that, we reported a small surplus of 3.1 million. That compared to our plan, which was broadly break even, as people perhaps see here. But when you take into account that we also within that 3.1 million we have an impairment adjustment for our property, which goes up and down according to the prevailing markets. If you adjust for that, our operating surplus was 0.3 million pounds, £300,000. So basically break even, which is what we set out to do. So we were on plan, which was a really great result. And not only that, against the backdrop of COVID, we also delivered cost savings of about 3.7 million, which was all in the second half of the year. During the first half of the year, we hadn't set any savings goals given the climate in which we were operating. So none of that comes easily, arriving on plan or delivering savings. And it's really through the collaborative working that Andy has emphasised and Dawn alighted on too, that's really enabled us to achieve that. So I'm extremely grateful for that, given it's the main thing I worry about. But at the same time, I know a lot of people out there are concerned about it too. So I think we're in a really good place. Again, just to add something about where the money comes from. I mean, it all mostly comes through our what was the CCG in the future. Not the Clinical Commission Group, but will now be the Integrated Care Board or the Integrated Care System. And we remain about half and half mental health community services in terms of the money coming into us and what we are contracted by the ICB to do. There's been more growth within mental health this year, mostly through to the expansion of IAPT, which is the Improving Access to Psychological Therapies, and underwritten in many respects by what's called the Mental Health Investment Standard, which was the commitment in order to that mental health would get a de minimis growth in income each year, and that's really helping us in order to expand services in that particular area. But also our community services have grown too, and that really comes through the sexual health service, which again was mentioned a little bit earlier on, where we're now the lead provider. So all the income for sexual health for the residents of Dorset comes through Dorset Healthcare, and we contract other people, not only ourselves, but other providers in order to help us deliver those particular services. So an expanding revenue, 320 million, and that supported an increase as well in the number of people that we employed. So average through the course of last year was approaching 5,700 people. So where did the money go? Well, mostly on staff. Given that we're now employing 5,700 people, it won't be surprised that most of that money is being spent on staff. It's approaching 80% of our total costs, but we do naturally enough spend money in other areas. Purchasing healthcare, we subcontract to other people, perhaps our partner organisations at DCH or at Universities Hospital in Poole and Bournemouth, or to other providers of healthcare type services. And then a significant amount we're spending on the consumables and the property related costs that go with running our organisation. We also spend capital money, and again this will chime with comments made earlier on. Through the course of 31st March 22, that year we spent £13.5 million. A number of the things here we've heard about already: the eating disorders unit, which is under construction, the vaccination centre, which we developed at Kings Park in very short shrift. But naturally, we also have spent quite a lot of money on backlog. We have got old buildings, and that is going to be a continuing burden on the trust as we go forward in maintaining and upgrading those buildings. And we've made a particular emphasis over the course of last year and over the course of the next few years, I think, towards reducing risk within our mental health inpatient units, with reducing or ameliorating the risk of ligature. So installing doors and furniture that really reduce and minimise the chances that people will not take the care of themselves that we would want them to, and keep them safe. So on that note, I think that rounds it off. As I've already said, really a good year. Over to you, Nicola.
I think it's come back to me, Matthew, first of all, just to pass the ball smoothly on. So I think, thank you, Matthew, and as ever, thank you to all your team for the hard work that goes on behind the scenes to keep us in a strong place. And I would just emphasise, having strong financial control does allow us to invest in our services, both on capital and on revenue. So it's the precondition for delivering outstanding care. So thank you. Now, I know we jumped earlier on to take some questions. I'm hoping that we'll have some more questions now as the meeting's gone on. So I'm going to check in with Nicola to see if there are any more questions that we want to cover off, Nicola, before we start on the final landing approach. Nicola, over to you.
Thanks, Andy. Yes, so we have had one last question come back in, and I'm delighted to ask myself to answer that. And someone has talked to us about the workforce shortages in the NHS that we're hearing about. and what are we doing to attract and retain our staff? And I think it is absolutely recognised locally and nationally that the staffing and workforce supply position is very challenging. We heard last month that there was the highest number of people ever in the first quarter of this year voluntarily handing in their notice. So we know historically high numbers of people are leaving NHS employment, and recognising that there is always more that we can be doing locally. In our organisation, it's been a tough 2 years, as it has right up and down the country during the pandemic. I think as well, though, that the workforce supply has been challenging for the NHS probably for some time, over many years, and not just in the past 2 years, and the result of the things that we've been through. For our organisation, our turnover has been going up. I'm pleased to say in the last months it has slowed, and for the past 2 to 3 months our turnover has now started to reduce, and I hope that we will continue to see that as we proceed into Christmas. But hope is not a strategy, and there is a lot that we are doing. And I think predominantly I always start with retention, because if we keep recruiting people but they don't have the experiences that they should have and expect, then we can't expect them to stay with us. And that's why we have been investing a lot more of our energy in wellbeing, of course prompted by what we've learned during the pandemic. And also thinking about the additional support that we can give people. So thinking about what more can we be doing to help people as we face a really challenging cost of living position nationally and of course locally. And I think as well, ultimately, how can we be a modern and supportive, responsive employer? So we're thinking about flexible working, we're thinking about more rewarding roles, making sure that workload is manageable, because we did learn through the staff survey, and this was a national statistic as well as locally, that the biggest area of concern for our staff was actually the availability of staff to be able to run services. And I think probably if we could confirm that we've always got the staff that we need when we need them, and we've got them in greater numbers than we need, then everybody would probably feel much better in the workplace. And that continues to be one of the things that we are working on. So we have also, though, improved our recruitment. Our recruitment team have done an amazing job, and for last year, broadly speaking, we were out recruiting the numbers of people leaving, although it wasn't like for like. We know that we can do that, and we have remained an attractive employer locally, but we know that we can't take any of that for granted, and this continues to be a really challenging position, and we continue to think about what is it that will improve people's working lives. A core part of that will be our transformation programme, where we are looking at bundles of services in very focused way, and actually thinking about ensuring that the roles are manageable, that we are building in time for rest breaks, and that we are building in time for people to undertake their training and development, and that development is satisfying and gives people a career with us for a number of years, or indeed allows them to be the best that they can be in their role. There is a lot underway. I won't run through lots of detail, but I'm really happy to have any further conversations, because it is absolutely a critical thing for us now and for the immediate future as well. Thank you. So thanks, Andy. I think that is it for the questions, and I would just say that we have put an email address into the chat Q&A if anybody would like to follow up afterwards. Thank you.
Thank you very much, Nicola. And can I just reiterate Nicola's point? You know, if ever anybody wants to ask a question, certainly I know my inbox is always available, and I know the rest of the team are really happy to answer questions. And as Nicola said, following this, please put any of those questions in the box and we will get back to you. So I think it's now time to say some thank yous. So a huge thank you to people that have joined us today. I know it wasn't quite as smooth at one stage as previously, but we're all allowed gremlins one year or the other. So my thanks for staying with us, and my thanks to the backroom team who put these events on. It takes an amazing amount of work, and I never, you know, when it goes a little bit off, you need to be calm, and this team are incredibly calm to get things back online. So thank you very much to everybody for that. To our teams who deliver the services, you never cease to amaze me in your expertise, your commitment, your excellence, and most important, your compassion to the way you look after our patients and each other. And it's on that note I'll just leave a kind of a plea, really. Please look after yourselves as best you can and your families as we go into winter. I'm hopeful that it won't be as bad as previous winters have been recently, but we just need to make sure we get ourselves vaccinated and as safe as possible, not only for ourselves, but our patients and our families. So thank you, everybody, for amazing dedication to our patients, to our communities. Thank you for joining us and supporting us. And I look forward to speaking to as many of you as possible over the coming months. Thank you very much.